While smoking carries serious health risks, like a higher chance of coronary heart disease, lung cancer, and stroke, quitting can help undo some of the damage and improve your health. Certain improvements will take time, but you don't have to wait long to start experiencing the benefits of smoking cessation. In fact, the changes will start to occur within minutes, hours, and days of quitting. Today on Big Progress, we're going to tell you about it in detail. But before we move on, make sure to subscribe to our channel and ring the bell to get notifications about new interesting videos. So what are the harms of smoking? Cigarette smoking causes more than 480,000 deaths each year in the United States. This is nearly 1 in 5 deaths. Smoking causes more deaths each year than the following causes combined: human immunodeficiency virus, illegal drug use, alcohol use, motor vehicle injuries, firearm-related incidents. More than 10 times as many US citizens have died prematurely from cigarette smoking than have died in all the wars fought by the United States. Smoking causes about 90% or 9 out of 10 of all lung cancer deaths. More women die from lung cancer each year than from breast cancer. Smoking causes about 80% or 8 out of 10 of all deaths from chronic obstructive pulmonary disease or COPD. Cigarette smoking increases risk for death from all causes in men and women. The risk of dying from cigarette smoking has increased over the last 50 years in the US. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, of women developing lung cancer by 25.7 times. Smoking causes diminished overall health, increased absenteeism from work, and increased healthcare utilization and cost. Smokers are at greater risk for diseases that affect the heart and blood vessels, cardiovascular disease. Smoking causes stroke and coronary heart disease, which are among the leading causes of death in the United States. Even people who smoke fewer than 5 cigarettes a day have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thicken and grow narrower. This makes your heart beat faster and your blood pressure go up. Clots can also form. A stroke occurs when a clot blocks the blood flow to part of your brain. A blood vessel in or around your brain bursts. Blockages caused by smoking can also reduce blood flow to your legs and skin. The science behind why it's so difficult to quit smoking is crystal clear. Nicotine is addictive, reportedly as addictive as cocaine or heroin. Yet any adult can stroll into a store and buy a pack of cigarettes, no questions asked. From a scientific standpoint, nicotine is just as hard or harder to quit than heroin, but people don't recognize that, said Dr. Neil Benowitz, a nicotine researcher at the University of California, San Francisco. Why must you quit smoking? Lung volume will increase, blood composition will improve, and blood flow will restore. Toxins in the body will be eliminated, the risk of stroke and cancer will reduce. There are some negative consequences though, which are the changes in metabolism and unpleasant symptoms during the first months of quitting. As soon as the body fully recovers, all processes will return to normal, but before that, you may experience tearfulness, aggressiveness, depression and anxiety, poor sleep, insomnia and nightmares, susceptibility to viral diseases and weak immunity, bad taste in the mouth caused by the liver regeneration process, frequent headaches and dizziness, increased hunger and weight gain. How's the process of quitting the bad habit going during the year? The process of quitting smoking is easy for some people, but the majority experience significant discomfort. The hardest time are the first 2 weeks after giving up cigarettes, which is when the active phase of nicotine starvation occurs. The body is already cleared of this substance, but has not yet gotten used to a new working regimen. Now we're going to explain in detail all the symptoms and consequences of giving up smoking. First day. In as little as 1 day after quitting smoking, a person's blood pressure begins to drop, decreasing the risk of heart disease from smoking-induced high blood pressure. In this short time, a person's oxygen levels will have risen, making physical activity and exercise easier to do, promoting heart-healthy habits. Second day. Smoking damages the nerve endings responsible for the senses of smell and taste. In as little as 2 days after quitting, a person may notice a heightened sense of smell and more vivid tastes as these nerves heal. Third day. 3 days after quitting smoking, the nicotine levels in a person's body are depleted. While it is healthier to have no nicotine in the body, this initial depletion can cause nicotine withdrawal. Around 3 days after quitting, most people will experience moodiness and irritability, severe headaches, and cravings as the body readjusts. 4th day, dizziness goes away, blood circulation restores, blood pressure drops, so tinnitus may occur. Perhaps there will be a feeling of viscous lump in the throat. This means that the bronchi are rearranging their work. Depression begins to retreat, and so does aggression. However, sleep hasn't returned to normal yet, and the appetite is still increased, with terrible cravings for sweets. 5th day, the lungs continue to recover, and mucus may appear when coughing. Vigor decreases, so there's a high probability of returning to smoking. You must remember that all people who quit smoking experience such sensations. At this time, person's receptors perception restores. 6th day, the stomach recovers completely, so quite often constant thirst and bitter taste in the mouth appear, as well as pain in the liver area. Aggressiveness and excess sweating may occur, and some people may even experience hand tremors and nausea. Self-control reduces, and in some cases, sedative medications may be required. 7th day, the body gradually rebuilds itself to a life without nicotine, so there's a probability of stool disorders. Fatty food is absorbed badly, but the appetite is still increased. Smoking cessation can cause the feeling of emptiness, as the person realizes that smoking was more of a ritual than a need for nicotine. At this period, it's better to avoid any mention of smoking so as not to return to cigarettes. 8th day, the sense of smell restores almost completely due to the regeneration of the olfactory receptors. Smells seem to be brighter and the food tastier. The person may begin to gain excess weight. Aggression diminishes, but feelings of loss and depression, as well as confusion, are still present. Insomnia and restless sleep are common. 9th day, the process of blood formation returns to normal, and the functions of mucous membrane normalize. Immunity is still weakened, so beware of colds and allergies. Smoke provokes rejection, but there still is chance of returning. 10th day, the risk of smoking again is very high without the support of relatives and friends. The immune system gradually begins to recover. 11th day, since much more oxygen enters the body, fingers tremble and headache may occur. The person continues to be hot-tempered and vulnerable. They want to smoke a cigarette to remember its taste, but the actual smell of tobacco is disgusting for them. 12th day, the condition of the skin improves, the face acquires a healthy color, the cough becomes less severe, the intestines restore, but despite all physiological improvements, depression is still strong. 13th day, there's a risk of sickness, blood pressure surges, but the risk of returning to smoking decreases significantly on this stage. If a person does 2 weeks without cigarettes, then most likely they can do more. 14th day, in the days and weeks that follow, you should start breathing easier, your circulation will improve, and your cravings should ease. A month without cigarettes. In as little as 1 month, a person's lung function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. Athletic endurance increases, and former smokers may notice a renewed ability for cardiovascular activities, such as running and jumping. Aggression and irritability will be less pronounced, but the risk of return in stressful situations remains high. The urge to smoke comes and goes. 6 months without smoking, the head no longer hurts, the cough goes away, the dry throat symptom disappears. The person stops gaining weight, appetite and sleep return to normal. By this time, skin cells are renewed completely, so dryness and peeling also go away. The person is cheerful and active. In 4 months, the blood vessels condition will improve, the weight will stabilize, and in 6 months, the lungs will be clean and so their volume will increase. The stomach and intestines are restoring, and the liver begins to recover. 365 days without tobacco. The body has already regenerated so much that the risk of stroke is reduced by 30%, of heart attack by 50%, and of lung cancer by 80 to 90%. A woman who has become pregnant by this time may not worry about a miscarriage. The probability is not higher than that of non-smoking women. A pregnancy failure is also unlikely. Isn't it worth quitting smoking? 20 years after quitting smoking. The longer we do not smoke, the better our health becomes, and despite discomfort, the body regains its health and functions. The more time a person smoked, the longer it would take to recover, but in 20 years after quitting smoking, significant changes will be seen. The risk of stroke will reduce by more than 50% and it will decrease every year. In 5 years after quitting smoking, blood vessels will be fully restored, so the risk of thrombosis and stroke will also reduce. In 10 years after quitting smoking, the risk of dying from lung cancer will reduce by 50%. In 13 years after quitting smoking, the teeth will be similar to that of a non-smoker. In 15 years after quitting nicotine addiction, the risk of pancreatic cancer will decrease. In 20 years after quitting, the risk of dying from any smoking-related health issues will reduce to the level of a non-smoker. Quitting smoking can be difficult, but despite any potential challenges and setbacks you may encounter, the benefits of smoking cessation are clear. Long-term, your risks of stroke, lung cancer, and heart disease drop to a level that's comparable to someone who has never smoked before, and the sooner you quit, the better the benefits appear to be. And that's all we wanted to tell you today. If you've learned anything new or decided to quit smoking, click the like button and subscribe to our channel. We make new videos about your health, nutrition, gardening, and housekeeping every day, so make sure to ring the bell to get notifications about them.